Here is your question. Okay, so if you have read and understood, considering a surgical pathology station, kindly tell me what are the provisional diagnoses that you will consider for this patient?
Okay, maybe aortic stenosis with
And?
mitral regurgitation, rheumatic heart disease,
And?
or uh,
last could be infective endocarditis, but
yeah, infective
not actually.
endocarditis.
So if you have to establish your diagnosis, rheumatic heart disease, what is the criteria that you will consider?
We have Renton criteria
What
for
is it,
rheumatic.
please?
Okay, if we have like patient will have positive blood culture and just 1 second, like one major criteria or 2 or 3 minor criteria. Okay, the major criteria, if the patient have rheumatic heart disease, actually I couldn't remember anything.
Okay.
So
Make it simple. What exactly is rheumatic heart disease? How would you define it?
okay, rheumatic heart disease, if we have patient have uh,
It's
in
a
the
type of cardiac
uh,
inflammation. And how does it begin? It's
like
autoimmune.
if we have autoimmune, like
Yes.
we have mimic the protein in the body mimic the
Mimics type 2 hypersensitivity reaction, but its infection is with group A streptococci.
streptococci. Again, it's the heart valve due to like pharyngitis, west pharyngitis, or uh,
Yes,
bacteria mimic to the M
streptococci yes,
protein of the
yes.
body of the heart, lead to distracted of the
So
valve.
broadly, if you'll divide it into gross finding and the microscopic findings. So first we'll come to gross findings. What would you see? What would you find in acute phase and then in chronic phase?
Okay.
And how would you confirm your diagnosis? What investigations would you go for?
Okay. Gross finding, we will أشوف his body. No, no, this is microscopic
Okay,
finding.
these are one
أشوف
of
his
the microscopic findings. And
أشوف his body and anti-atrophic cells and uh,
granuloma formation.
granuloma, yeah,
And
placing.
would you be able to tell me the pathophysiology of rheumatic heart disease? Like how does it begin? How the disease process begins and propagates or propels?
Okay, if the patient have infection or like pharyngitis or other respiratory infection
Yes. And
with staphylococcus with streptococcus pyogenes,
yes.
then the bacteria have the body have The bacteria have M protein, mimic the protein found in the heart,
Good.
lead to autoimmune against antibody antigen, like
Very good.
autoimmune against the body,
Yes.
lead to distraction of the valve and like fragmentation, something.
Yeah. And
Uh,
there'll be
uh,
fibrosis, narrowing and
yeah,
stiffening of the
fibrosis,
valve.
killer, yeah,
Yes.
scarring,
And retraction
and
of the
also fish, like fish mouth, like appearance.
appearance. Yes, on
The
ultrasound.
yeah, like yeah, vegetation also will be
Yes.
maybe.
Yes. So this is the finding that you'll find on ultrasound. What else? What type of ultrasound would you do?
Echocardiogram,
Yes,
2D.
2D, right?
Also, I'll go for blood culture and
Yes. What do you expect to find in blood culture? Would it
yeah,
be always positive? Yes.
positive group A beta streptococcus pyogenes,
Would you find
and
anything on ECG?
yeah, ACG will find according to which valve affected, like oh my god,
Yeah.
uh, if it is aortic stenosis, uh,
Just suppose
well,
it's simple rheumatic heart disease. You do ECG. Would you find anything on ECG or not?
yeah, we'll find yeah, but I couldn't remember.
Would there be anything of yours, like anything of significance? How would you then manage the patient?
Give the patient according to hospital trust antibiotic
Okay.
and uh, uh, check the availability of the valve and how much is stenosis, and uh, if like severe stenosis, then like go for valve replacement, and if like just rheumatic fever, rheumatic heart disease, we can
Yes.
treat it by good antibiotic and
What is one simple blood test that can be done to monitor the progression of rheumatic heart disease?
blood culture.
Yes, sir.
Yes,
Okay. What else do you do for the management?
Spanish. Didn't know.
Okay. Can you please tell me what are the complications that can occur if you don't treat the patient on time?
If I didn't treat the patient, we will
Yes.
found like uh, uh, lead to like rheumatic valve disease, like aortic stenosis or mitral valve stenosis, and lead to infective endocarditis,
Yes.
and what else? Maybe lead to uh, heart disease. All heart disease
Yes.
can happen.
If you think you have established that, okay, because of rheumatic heart disease, patient is undergoing aortic stenosis or any other multiple valve stenosis or regurgitation, uh, what would you suggest? How should patient be managed? Patient is young, patient is pregnant, and you have to consider that it's two lives at risk.
Yeah, mom, the patient now have like which problem exactly? Like infective endocarditis or aortic
Look,
stenosis?
whole scenario is in front of you. What is NYHA grade? What type of grade is this that we're talking about? And in this grade, patient has come with the mitral valve regurgitation 3/4. It's severe mitral regurgitation, and it's common in pregnant females of Asian background.
Mm-hmm.
So that is the kind of history that gives you immediate hint that it could be rheumatic heart disease. What would you do?
Oh my
So
God.
management will consider the pregnancy of the patient as well, the age of the
Yeah.
patient, the condition of the patient. What's the treatment for mitral regurgitation? This is not so simple that you'll do the mitral valve replacement surgery. Many things you would have to consider in order to manage the
Yes.
patient. Yes, maybe
Yeah.
premature delivery of the fetus or terminate the pregnancy, or depends, because now if you'll not manage the patient can go into heart failure.
Yes.
Yes. So that is the most serious and consequence like that you can expect to find or can happen, even can cost the life of the woman and the baby. So good.
Mhm.
Hey, thank you.